Hi, I'm Seth Gladstein. I'm a trial lawyer in Louisville, Kentucky. I focus my practice on medical malpractice, nursing home abuse, and other serious injury cases. I'd like to talk to you today about cases involving the failure to timely diagnose and treat strokes. According to the U.S. Centers for Disease Control and Prevention, stroke is the third leading cause of death in the U.S. Every year, an estimated 795,000 Americans suffer a stroke. That means stroke is one of the most serious and deadly medical events possible. However, strokes are misdiagnosed at a shocking rate, especially among the very young and very old. Strokes occur when the brain's blood supply is blocked or insufficient. There are two types of strokes. An ischemic stroke occurs when the brain's blood supply is cut off, typically by a blood clot known as an embolism or thrombosis. A hemorrhagic stroke occurs when blood leaks from the vessels into the brain. Strokes can affect many parts of the body, and if not timely diagnosed and treated, can cause death. As with heart attacks, it's absolutely necessary to timely diagnose and treat a stroke as soon as it occurs. Negligently failing to diagnose and treat a stroke can cause serious complications or death. Some commonly accepted signs and symptoms of a stroke include the inability to speak or understand speech, confusion, imbalance and problems walking or ambulating, sharp, sudden, severe onset headaches, numbness in the face, legs, arm, often only on one side of the body. If a patient begins exhibiting these signs and symptoms, it's absolutely imperative that that patient's healthcare providers perform a thorough examination, including researching the patient's medical history. Any patient suspected of having suffered a stroke must undergo diagnostic testing, such as radiographic imaging, and undergo lab work. In virtually all cases, a stroke patient's chances for a best recovery is when the stroke is timely diagnosed and treated. Otherwise, irreparable injuries may result. There are a number of reasons why strokes go misdiagnosed. Many physicians attribute a patient's stroke-like symptoms to a headache. Additionally, a recent study from Johns Hopkins University found that 30% of ER doctors are more likely to overlook physical signs and symptoms of a stroke in women and minorities. In many cases, a stroke misdiagnosis occurs because of failing to perform the correct diagnostic tests or radiographic imaging, failing to recognize the presenting signs and symptoms as being consistent with stroke, failing to timely administer clot-busting medications such as TPA. Complications associated with a misdiagnosis of stroke or a delayed diagnosis include behavioral changes, memory loss, paralysis, cognitive deficits, speaking or swallowing difficulties, loss of the use of an extremity such as a foot, arm, leg, or even worse, death. Please call Gladstein Law Firm PLLC today at 502-855-4177 or 800-991-0474 to schedule your free consultation. You can always reach us online at www.gladsteinlawfirm.com. Please don't hesitate to contact us, as your time to file a medical malpractice claim in Kentucky may be limited.